an obstetrician in this day and age is a really important process for women. Today's woman is totally different than, for example, what your mother may have experienced with her healthcare provider. In those days, we told women what to do. They listened to us without question. Today, we want your questions. We want it to be a partnership where you're an equal partner in your healthcare. And in obstetrics, it's particularly important because yes, it's a medical event. Yes, you want to get the best care for your health and your baby's health. But it's also a big part of your life. These are your children, this is your future. It's a life event, it's not just a medical event. You should feel comfortable, confident, like you can have a dialogue, you can ask questions, you can question the doctor. We want that. It should be fun. You should have your anxiety relieved. Sometimes little questions come up, such as, can I take this cold medication? Or is what I'm feeling normal? And you want to know how you can communicate with your doctor. Sometimes it's this simple way of picking up the phone and calling. Here at Beth Israel Deaconess, we have a tool, a web-based tool called Patient Site that allows us to communicate with our patients, for patients to communicate with us securely through the web, through email, for example. If they have a simple question, a medication that they're wondering if they might take, non-urgent things, and it can be a very nice additional way to allow convenient communication. One of the most important things to remember when you're choosing a physician is that your physician is one member of a large healthcare team. And it takes that whole team for you to have safe care, quality care, and care that you feel like is a pleasant, enjoyable experience that relieves your anxiety. For example, the person who answers the phone, are they attentive to your needs? Can you reach the nurse with questions? Yes, the doctor is an important part, but they're only one member of this healthcare team. So when you choose a physician, keep that in mind. When you're picking a doctor to deliver your baby, you're also picking a hospital. And to pick a good hospital, you want a place where the nurses have a world-class reputation, where they welcome you and your family. However you may define family may be different from one woman to the next. You want a place that's welcoming to all of you. You want your family to feel like this was one of the best moments of their lives. You can do things like take a tour, watch the people around you, how they're being treated, how they're being greeted, the person that delivers the food. You want all of those people to treat you with dignity, with respect, with professionalism. The wonderful thing about obstetrics is the vast majority of the time women are healthy and babies are healthy and things turn out beautifully. So when you're looking for a physician, one thing that you may care about is that they will be as hands-off as possible, understanding that this is a totally natural experience and much of the time all is well. On the other hand, sometimes even in healthy women, complications can arise, and you may want to ensure that the backup teams and higher tech care is available in an instant. You want to know that your doctor is well trained, that they've done a certain number of deliveries, that they're able to handle emergencies. As important is their access to specialists. Can they partner with high-risk obstetricians, for example, or neonatologists, doctors that can take care of very little babies on the off chance that something happens and the baby comes early. That can give great peace of mind to know that the access to that high level of care is available in the moment if the need should arise.